Hi, my name is Leah Gillum, and I am a Senior Director of TraumaWise Practices. In early childhood care and education settings, infant and early childhood mental health consultation really means supporting the entire center. That includes the administrative staff, the teachers, of course the kiddos who are enrolled, their families, really just trying to create the best environment possible. It means building the adult's capacity to support children by really digging down and addressing their complex trauma, emotional, behavioral regulation, social emotional skills, early childhood mental health and development, prevention, and of course, really strengthening those healthy attachments. As an infant and early childhood mental health consultant, working in an early childhood care and education setting, consultation looks unique every day. First, we typically observe classroom dynamics, and we will jointly create a support plan with that teacher and the Early Learning Center based on their needs. This can involve observations to note patterns, or means to create recommendations and to better understand the teacher's strengths, what in-classroom support is needed during that time, building social skills groups with the children and the teacher, teaching regulation strategies, coaching, mentoring, modeling for the teacher ways to support challenging behaviors or transitions, and identifying and making referrals to community resources as needed. There really is so much to do. At times, center staff have asked us to attend meetings between them and families to help address needs and concerns regarding a child and to assist that family with referrals. This is part of the coaching modeling piece where when we work with the teacher to build their knowledge, confidence, and skill to lead to these types of conversations themselves. Each center and classroom partners with us uniquely since it's truly based upon the needs of that classroom and that teacher. So when we conduct observations in an early childhood care and education setting, generally we enter the classroom or watch a live video feed of the classroom. We can also stand outside the classroom from time to time to observe. During this time, we're taking notes on what behaviors and actions we see, interactions between the children and staff, and between the children in the classroom. We typically write down any challenges that we notice coming up, as well as the strengths of the provider that's in the classroom. We recommend that the infant and early childhood mental health consultant observes a few times before working with the teacher and staff to develop the plan, because when a new person enters a classroom, children often respond to the presence of that new person, are distracted. Their typical behavior might be altered a little bit. Additionally, a teacher may run the classroom differently when they know that someone is observing. So by observing a few times, the children and staff become more comfortable and generally return to their typical routine. Once we conduct a few observations and have talked with the staff about what we are noticing, we develop a plan to address those needs. Once the plan is created, we continue weekly, bi-weekly, or monthly observations where we as the consultant note how things are going, how tools or strategies are or aren't working, looking for scaffolding opportunities, and address new needs that arise. An infant and early childhood mental health consultant will use coaching when meeting with the director of a center and the teachers regarding our observations. We focus on a specific strength and talk about how to build upon that strength. We also use coaching to support a new strategy in a classroom to reinforce its effectiveness. Then after the staff have mastered a new skill or strategy, we move on to the next established goal and offer the same coaching and support. When an infant and early childhood mental health consultant is modeling in an early childhood care and education setting, we are showing and demonstrating skills. We use timers and warnings for transitions, emotional regulation strategies, connecting strategies, and correcting strategies. We are also modeling evidence-based models. Transitions are a very tricky time for kiddos, especially those who have experienced harm and unpredictability. As we model, we use multiple ways to lead kids through transitions to track what is working well and what's not working well. We also model responding to behavior immediately, directly, efficiently, meaning we do not have a disproportionate response to the behavior. It's action-based and leveled at the behavior and not the child. We also model leading the teacher and children through proactive teachings around building towards self-regulation, and we do so by teaching through play. When screening tools are needed or used in an early childhood care and education setting, we can use the TBRI observation form, and that helps us track progress, the Ages and Stages questionnaire, the Social Emotional Opportunity Needs Assessment, and the social determinants of health screeners. Infant and early childhood mental health consultants who are trained in certain tools can also then train center staff on how to use them, which increases their capacity and competency of the center. For early childhood care and education settings, an infant and early childhood mental health consultant is often connecting teachers, directors, and families to resources, is offering trainings that are specific to the needs of the center and that also align with the strengths and expertise of that consultant. Infant and early childhood mental health consultants are requested in early childhood care and education settings for various reasons. Sometimes it's due to behavioral needs in a classroom, a child at risk of being removed from their center due to behaviors, or directors really wanting new and seasoned staff to have extra support and gain knowledge regarding child development, trauma, and early childhood mental health. One of our overall goals is to support staff and combat burnout. We are assisting in reducing the number of children being removed from centers, as well as unwanted or challenging behaviors in children. The impact of infant and early childhood mental health consultation in early childhood care and education settings is the improvement in social skills and emotional functioning, reduction in challenging behaviors, and a decrease in expulsions and suspensions. Consultation also improves the overall quality of classrooms by promoting healthy relationships and effective teaching strategies, supporting early childhood educators by reducing stress, burnout, and turnover rates. By providing infant and early childhood mental health consultation, we're not just assisting teachers, we're also assisting in improving the systems that children grow in, such as school and family systems.